Hello again. This is Karen, and I'm one of the nurses from Cardiac Rehab. So, for the week's lecture, we'll be focusing on effective communication. Healthy communication is one of the most important tools, especially in self management of any illness or condition. Healthy communication is also very important in building and maintaining good relationships with friends, family, or even healthcare providers. So, in this presentation, we will discuss tools to improve your communication. The tools can hopefully help you express your feelings and get positive results and avoid conflict. We will also discuss ways to politely say no, ask for help when needed, recognize body language, and ways to communicate with the healthcare team. So, communication is a two-way street. And if you are uncomfortable expressing your feelings or asking for help, other people probably feel the same way. It may be up to you to make sure that the lines of communication are open. Here are two ways to better communication. Number one, do not make assumptions. Now, we often think, oh, they should already know about it. But remember, people are not mind readers. If there's something that you want other people to know, you have to tell them. Also, you cannot change how other people communicate. We cannot control other people's actions, nor their feelings or how they respond to you. What you can do, however, is change your communication to make sure that you are understood. So, in this slide, we have a situation. We have two friends, and their names are Manny and Justin, and they agreed to go to a football game. However, when Manny came to pick Justin up, Justin was not ready. In fact, he was not sure that he wants to go to the football game anymore because he was having trouble with arthritis in his knees. So, for our first set of conversation, here's how it goes. Now, Justin says, "You know what? You just don't understand. If you had pain like I do, you wouldn't be so quick to criticize. You don't think of anyone but yourself." Manny responds, "Well, I can see that I should just go by myself now." So, what do you think of that situation? In that conversation, neither Manny nor Justin stopped to think about what was really bothering and how they felt about it. Each person even blamed the other person for such an unfortunate situation. Now, let's look at a different conversation, but now they're going to use more of a thoughtful communication approach. Here's how it went. Manny says, "You know what? When we have made plans and then at the last minute you're not sure that you can go, I feel frustrated and angry. I don't know what to do. Should I go on without you? Or should I just stay here and change our plans? Or just not make plans?" Justin responds, "When this knee acts up at the last minute, I'm confused too. I keep hoping that I can go so I don't call you. I don't want to disappoint, and I just kept hoping that my knees get better." Manny responds, "I understand." Justin says, "You know what? Let's go to the game. You can let me off the gate so I don't have to walk too far. I can do the steps slowly and be in our seats when you arrive. In the future, I will let you know sooner if my arthritis is acting up." Manny responds, "That sounds good to me." So, as you can see in that example, Manny and Justin talk about the situation and how they felt, and neither one actually blamed the other person. So, these are some suggestions for using good communication and creating a supportive relationship. Number one is to always show respect and avoid demeaning or blaming statements. Also, be clear and try to describe the situation. Like we said earlier, do not make assumptions. Ask for more detail if possible. Express your feelings openly and honestly. And listen first. Remember, good listeners seldom interrupt. Accept the feelings of others, and sometimes that can take time and effort. Sometimes it also helps to introduce a little bit of humor, but just make sure you know when to draw the fine line. It's helpful to know when to be serious. And don't play the victim. Now, what I mean by that is you become a victim when you don't express your needs and your feelings. Like we said earlier, we cannot control other people's actions and we cannot control other people's thoughts. We can only control our own communication and make sure that we express ourselves and communicate what we need so people know how to help us. So in the slide, we have two columns, and each row they share a similar phrase or a similar idea. Now, I'll give you a few seconds here to read the phrases and tell me which column you think delivers a better communication. You think it would be the left column or the right column? Okay, I think we can all agree that the right column provides better communication. As you can see, the left column is the you messages, and they often suggest blame. What happens is that the person that is being addressed, they may feel attacked and then they become defensive. On the other hand, on the right column, on the right side of the screen, you see examples of I statements. And most of those statements, they start with the word I. These are strong and direct ways to express your views and feelings without suggesting blame on the person that you're trying to address. If using I statements seem a little bit difficult, you can try starting out your sentences with the following phrases. You can say something like, you know what, I know this, and then you state the facts. You can say, I think, and then you state your opinion. I feel, and then you say what your feelings are. Or you can say, I want, and then state exactly what you'd like for the other person to do. Besides I messages, these are other ways to reduce conflict. Number one is to refocus the discussion. So if you get off topic and emotions are running high, you can try and shift that focus. You can also ask for more time. So, for example, you can say something along the lines of, no, I think I understand your concerns, but I need more time to think before I respond. Also, make sure to understand the other person's point of view by summarizing what you heard and asking for more clarity if needed. Also, you may not always find the perfect solution or reach 100% agreement with every single person that you talk to. However, it may be possible to find a middle ground and look for a compromise. Also, say sorry. Sometimes all it takes to restore a relationship is a simple and sincere apology. And along with that, I also want to learn how to accept an apology graciously and tell them how they can make it up to you and make amends. Okay, so even though most of us need help, only a few of us actually like to ask for it. We may not want to admit that sometimes we are just not able to do things for ourselves. We just don't want to burden other people. We all want to feel supported and understood, especially when things seem out of control. So, when you talk to someone, you want to make it clear what you need. It's also important to talk to someone that you trust and can speak openly with. So, this can be your sibling, your best friend, your spouse, or a healthcare professional. If you plan to talk one on one, find the right time to talk to a comfortable and private setting. And when you talk, Describe your feelings, your thoughts, moods, and how your body feels. Give them a clear picture of the situation and tell them what you need. Be as specific as you can. Remember that a specific request is more likely to have a positive result. All right, one thing that a lot of people struggle with, saying no can sometimes feel like a challenge. We're taught to follow the rules, be polite, and keep the boat steady and just being on the go. But you know what? Where's the line? The difficulty in saying no lies in navigating these deeply embedded social norms without losing our ability to stand up for what we truly believe in. On a picture, Steve Jobs has a famous quote. Steve Jobs once said, I'm actually as proud of the things that we haven't done as the things I have done. Innovation is saying no to 1,000 things. But as we all know, you don't have to be the CEO of Apple to harness the power of saying no. So, on the screen are some ways to politely say no. You can say, thanks for thinking of me, but I'm going to have to pass. It sounds something friendly and non committal. If you need to also express desire, but a clear inability to maybe attend an event or something that you're invited to, you can say something like, you know what, I wish I could, but it's not possible for me right now. You can also say, I'll need to check my schedule. Can I get back to you? And that buys time for consideration. You can also use the phrase, you know what, I can't right now, but I know someone who might be interested. So that way, that phrase provides an alternative to the original request. You can also say, I'm not comfortable with that, but I do appreciate the offer. That sounds honest. You're saying no, but it's still very polite. And you can also say, you know what, before I answer, and then you want to ask key questions, and that is to clarify the request and prevent the person from assuming that you're just going to say yes all the time. Effective communication should clearly express your ideas and feelings in a respectful and authentic way. It's important to be aware that no matter what you say, your communication will be ineffective if your body language contradicts your words. So, when we say body language, that includes your posture. Are you sitting or standing up straight with your head and your shoulders back in a relaxed and open manner? What about your eye contact? Are you maintaining a soft, non intimidating eye contact? Are you fidgeting or are you distracted by texts or people walking by? What about the tone, volume, and the pace of your voice? Are you speaking in a calm, even voice, or are you louder or yelling or more pressured? What about your facial expression? Are the muscles around your eyes giving away your thoughts of anger, impatience, or disbelief? Is your mouth open as if you're ready to interrupt at any moment? Or what about the level of intensity? Are you tightly contracted, or does your body language and facial expression convey an open and respectful curiosity about the other person's perspective? And your gestures, are you nodding? Are you shaking your head, shrugging your shoulders, or any other gesture that may be communicating in a way that's not helpful? So these are the things that we have to be aware of. And a good strategy to get the most from your doctor's visit is to take part. This is an acronym and it stands for prepare, ask, repeat, and take action. So we'll see some examples of how to address each of the components in the next slide. Before visiting your provider, you want to prepare. Remember, it is helpful to have a list of your concerns and questions, and you want to prepare that obviously before your doctor's appointment. And you can have the list either written down or you can have it on your phone typed up. If you are also taking new medication since your last visit, you want to be sure to bring an up to date list of your medications, especially if you're seeing multiple providers in multiple specialties or different organizations. Also, be prepared to describe your symptoms. That could be that can include components like, when did your symptoms start, for how long, where is it located, have you done anything to make it better, have you taken any medications to make it better, what about any activities that make it worse. And if you started a new medication or treatment since your last visit, you want to be ready to report how it went or any concerning adverse effects of the new medication. The second component is ask. This is your most powerful tool in healthcare self management, and that is the power of question. Asking questions can fill in important missing pieces and close the critical gaps in communication. So be prepared to ask questions about your diagnosis, your tests, your treatments, and any follow ups that you need to do. And one way to check that you have understood everything that comes up in your appointments is to briefly report back the key points. So, for example, you can say, "Oh, do you want me to take the medicine twice a day or was it three times a day?" So remember, repeating gives the provider a chance to correct any misunderstandings. Let's say in that example that the provider actually ordered the medication for you to be taken three times a day with meals, but then your understanding was that it's supposed to be only taken twice a day. So it was really good to have that opportunity to repeat um, the instruction that was given to you by the provider, and because you repeated it and some way there's that I guess misconstruction, or you in some way you didn't fully understand what was the original instruction. At that point the provider can actually address that and make sure that you understand what the proper dosage and the proper timing for your medication is. And if you don't understand or remember something that the provider said, make sure that you say something or ask them to go over it again. Also, we all know that sometimes it's hard to remember everything, so you can, bring a pen or paper with you, take notes if you need to. You can also bring in another person, like a caregiver or a family member, but make sure that is allowed by the facility. And lastly, you want to take action. So at the end of the visit, you need to understand what to do next. So, what action you need to take, and that includes treatments, tests, when to return for a follow up visit. You should also know the danger signs, such as for a new diagnosis and what you should do if they occur. And also, most of the time, your provider's office will provide you with written instructions, and that can be in the form of what we call a discharge summary or an after visit summary. Also, if for some reason you can't or won't follow the doctor's advice, make sure you say something. So, for example, you might say, "My insurance doesn't cover that much therapy or that much medicine, and I can't afford it." So instead of just completely ignoring the order for that medication or the therapy, make sure that you say something to your provider. If your providers know what you can't or won't follow an advice, they actually might be able to make other suggestions or refer you to the right people, like a social worker or a case manager. And that is the end of my presentation. These are the references. Thank you so much for listening. And like I said, if you have any questions, feel free to reach me or any of the staff in cardiac rehab. Thank you.